Hi there, this is Olivia Farrell. This is a review of my pocket guide that I created for NU 664 over the course of the semester in 16 weeks. I took key information that I needed throughout the course and put it in this extensive guide. It is quite long. I did it based off of the week and the things that really pertained to what I would need in practice. The first for week 1 was the cervical cytology, specifically the ACOG guidelines that were listed quite here in order to perform pap smears, when to perform pap smears, and the interval of how often. And then HPV co-testing guidelines I added in as well, and then in HPV further information on the Gardasil vaccine as well as the types and strands associated with cervical cancer and genital warts. I then included breast health, very important, especially for us going into women's health nurse practitioners, to know when mammograms should be performed and when we should indicate to our patients when they should be tested. I included high risk for breast cancer as well, so that I can be on the lookout for patients that might be at risk for breast cancer based off of these guidelines. And then fibrocytic breast disease, kind of included a little bit about that, more about BRCA1, BRCA2. And that kind of is week 1. Week 2, we focused in on thyroid. I included hypothyroidism, what to expect in terms of signs and symptoms, levels to be aware of. Let's go through this. And then treatments for hyperthyroidism, what that might look like. I included that as well. And then we move on to anemia. We have microcytic anemia and macrocytic anemia, iron deficiency anemia, treatment, when to stop treatment, when to resume treatment, thalassemia, information, diagnostic criteria, and then we move on to week 3, which was asthma. I included clinical presentation, what to look for, diagnostic testing. I found these images important for me in terms of being able to identify what to add to somebody's regimen, what to take out from somebody's regimen based off of if they are a individual with different types of asthma symptoms. And then I included the key medications necessary in treating asthma depending on if the person is considered intermediate, mild, moderate, severe. Here are the classifications. I thought this would be very useful in practice, especially if we're not dealing with asthma every day. I included the drug classes and what they're used for. And then we move on to pneumonia, clinical presentations, treatment guidelines, atypical versus typical. That's just kind of for the community-acquired pneumonia. And then we moved on to the contraceptive counseling. This one I put in thorough review, including the U.S. MEC guidelines for identifying hormonal contraceptive and IUD use. So I went through every single type of contraceptive available, the indications, contraindications, things to consider before prescribing. And I went through all of those, including patches, Nexplanon, IUDs, vaginal rings, spermicides, and barrier methods. And then we moved into hypertension, which was week 6. I kind of discussed diagnostic terms for hypertension as well as physical examination findings, and then I included information specific to each of the medications that are used for hypertension. I also encouraged education and counseling. That's going to be definitely part of our, everyday as providers. And then diagnostic treatment and referral for hyperlipidemia, because again, we live in America and this is going to be seen quite often. And went over the statin therapies, when to prescribe low, medium, and high. This was definitely going to be used in practice. We went over fenofibrate for high triglycerides, another thing that we definitely are going to see. And then thrombolytic diseases, we went over thrombosis. I did diagnostic evaluations, physical exam findings, laboratory testing, as well as Virchow's triad, which we often see with women who are who are definitely showing signs of endothelial damage, stasis secondary to immobility, hypercoagulability. And then we went over some testing and how we can further assess this. And then we went through menstruation. That was week 8. I went through the stages, of which we need to be very familiar. So I broke down the stages of the cycle. And then I went through the different definitions in terms of abnormalities in the menstrual cycle, and I included all the vocabulary that is needed. And then I went through primary and secondary amenorrhea and positive causes, as well as subjective findings, objective findings, labs, and tests. And then we went into hypothalamic pituitary ovarian, kind of like symptoms that could be shown and that we're going to see quite a bit of. Progesterone challenge for premenstrual syndromes and that inducing a period, ovarian versus an adrenal function test. And then I kind of included a summation because that was our first test and I wanted to be able to have everything kind of under one roof. So that's under my pocket guide. And then don't mind the review. The Tanner stages I included as well because we're going to see that quite a bit, as well as different types of reasons for primary and secondary amenorrhea. PCOS, another very common reason what we were going to maybe see amenorrhea, and how to diagnose that, as well as hyperprolactinemia. I included that in my pocket guide. More of the functional hypothalamic amenorrhea, Asherman syndrome, dysmenorrhea I included, and then I'll move on from this. This was just another review that I put in my pocket guide. Diabetes and gestational diabetes. I included screening guidelines for specifically pregnant women and evaluations, diagnosis, treatment, and what to look for in terms of criteria for the 1-hour glucose testing versus the 3-hour glucose testing if necessary after the failure of the first one. How to counsel and educate these patients. Those who need an insulin, A2 GDM versus A1 GDM, those who don't. I included some up-to-date information and antenatal monitoring that we need to be aware of. And then I went into type 1 versus type 2 below here, not to do with those who are pregnant. And then I went over more about the different medications with diabetes, and then week 12 was STIs. I decided to do major takeaways from the CDC modules, so I put them all in here that I found really pertinent to know in terms of STDs and STIs. There's quite a bit here. Testing, laboratory findings, treatment, post-treatment follow-up. And then I did another entry after STDs once we move down from here. Urinary tract infections, GU. I found GU to be very key in terms of knowing what the normal findings are versus what is abnormal. So I put those there. And then I discussed recurrent UTIs and kidney stones. And that was kind of everything that I put within my pocket guide that I felt pertinent for me and being able to continue on with my practice and be able to reference when needed. Thank you so much and have a great day.